I have dark eye bags. Do I need both fat graft for tear trough and orbital fat removal? Hi, I have dark eye bags, and my surgeon is suggesting fat graft for tear trough and orbital fat removal. I'm wondering if I really need both. I'm also worried about overgrafting, over removing, as doing one of the two makes the other less obvious already. And are the results of both permanent with no side effects? My doctor also says he will not remove excess skin, doesn't think it's needed, even though I think my skin is loose. Would be great to hear from doctors here. Thanks.
Thank you for your question. You've submitted a single, very limited photo of your eyes, and you're stating that you've gone to a surgeon who is recommending the reduction of orbital fat as well as the addition of fat grafting to deal with the relative hollows and dark circles. You also go on to write that you feel that there is excess skin under your eyes, although your surgeon disagrees with you. And so now you're looking for additional opinions. Well, let's just first understand that anyone who performs surgery of any kind has their own approach and style. And certainly you can't necessarily disagree as a colleague with someone else's approach if in their hands it works well for them. I will share with you my opinion based on my experience on what we do in our practice and the basis of why I make the choices I do. I'm a cosmetic oculofacial plastic surgeon. I specialize in eyelid surgery, facial rejuvenation surgery, hair loss treatment. We have several different areas in our practice that we do a lot of work in. And eyelid surgery is one of the things we do a lot. The challenge we have with a combination of either anatomy or aging or both is the prolapse of fat occurring with this at the same time as relative hollowing. So from my experience, I find that addressing the fat pockets, the prolapsing fat, and doing something like a transconjunctival blepharoplasty significantly improves the appearance of tired and hollow looking eyes. I always tell my patients, think of what's causing this tear trough area to look so deep. Well, adjacent to that deep trough is a mountain. So the contrast between the elevation and the depression is further accentuated. My hesitation about the use of fat transfer, as your surgeon is advocating, is based on a lot of experience where the fat is not predictable. And I don't think any surgeon would ever state that they can 100% guarantee within reasonable amount that they can really deliver the fat that they want to deliver the way they want it to take. Because you have to understand it's a graft. It means that it's being taken away and separated from its blood supply in another part of the body, let's say the abdomen, and then placed under the eye, and then we're anticipating that a certain amount of blood supply will allow that fat to integrate and become viable. What happens is 30 to 70% of fat will actually absorb. And from my experience, a lot of fat will actually become inflamed and become scarred, creating irregularities and lumpiness. So in our practice, what we typically counsel our patients to do is we'll do the lower eyelid puffiness. Most of the time, people don't need excess skin removal, so I think you'd be okay without that. And we will do something like the use of platelet-rich plasma to try to improve the skin quality and address the dark circles. Now, that being said, let's say after all this is done, you're still bothered by the tear trough. What we typically do is we'll combine Restylane or hyaluronic acid filler with platelet-rich plasma, and we can control and very specifically mold the area of the tear trough and get a very, very nice result. Now, it does require maintenance. From my experience and my style, I like predictability, and when there's a potential risk of an undesirable appearance that it outweighs the benefits, it's not worth doing. So I like using fat for grafting in other areas. I'll place it in hands for hand rejuvenation. I'll place it in the nasolabial folds, but I don't place it under the delicate eyelid skin where it can become very, very obvious or disappear altogether. A lot of times also people who have fat placed under the eyes will have problems with chronic swelling. So that's my bias, that's my opinion. It doesn't in any way mean that your surgeon is wrong, and probably discussing the merits of fat under the eyes and the timing of when to do it is worth discussing with your surgeon. So with that being said, I hope that was helpful. I wish you the best of luck, and thank you for your question.